My name is Anna Turumanya Kalumuna and I am the Executive Director. The reason we gathered this week is to bring awareness about cancer of the esophagus. Statistics from Uganda Cancer Institute reveal that it is the fourth killing cancer, at least in 2024. It is the second in men after prostate cancer. It is the third in women after cervical and breast cancer. It is a big threat. The way that disease progresses, eventually it blocks the esophagus of the patient. So what has been happening this week is an exercise of training doctors and nurses on how to insert what they call a stent. A stent is able to push aside the wounds, the tumors in the esophagus, and allow the patients to swallow again. Usually they are blocked, they can't swallow their saliva, they can't swallow any liquid, they can't eat, but this has been going on to enable them to be able to eat again. The advantage with this is that the doctors have been trained, so they can go back in their different hospitals and do exactly what they have trained with other patients.
So this training workshop was organized by AFREC, African Esophageal Cancer Consortium. It's a group of people that came together to try and understand why there is a high burden of cancer of the throat along the Eastern Africa.
Many other persons who have come, Soft Power and many other hospitals that we partner with.
East Africa and down to a bit of Southern African countries. This area has a particularly high burden of cancer of the throat. So the AFREC is a group that work together to try and understand why is this so, and also try to treat cancer of the throat effectively. The week is ending tomorrow with 4 teams of doctors having been trained in the technique of placing the stent for cancer of the throat. And the training has gone successful. AFREC sponsored this training, and this has imparted vital skills to the trainee team so that as they go back to other parts of the country, Western team, Northern team, Central team, as they go back, they can take back the skills with them, and the services will be available in these parts of the country. Yes, so AFREC has been operating in Kenya, Tanzania, and other countries for a few years, but Uganda had not joined this group yet, and this training marks the beginning of Uganda officially joining the AFREC group. As the AFREC group, for them, training is the first step in initiating a country or a team to join. So having successfully completed this training, Uganda becomes part of AFREC.
Okay, how many patients have you engaged with during this engagement?
We had 50 patients booked. We have so far worked on a good number, maybe about 30, and still more on tomorrow. For various reasons, some we are not able to report. Unfortunately, the exact cause is not yet known. We can't say if you don't do this then you will not get the disease, or if you do this then you'll get the disease. But there are a number of possible factors: smoking, drinking alcohol, and a number of factors that have not yet been proven. Taking hot beverages, could there be anything in the foods we eat that contribute to this disease? The exact cause is not yet known.